Good evening to one and all present here today. Thank you for tuning in for the webinar on cervical wellness, eradicating cervical cancer with visual assessment and specialist support. We have some of the industry experts with us here today who would be addressing some of the key issues faced in the area of women's health. And now, without any further ado, I would like to invite our first panelist, Dr. K. Madan Gopal, Senior Consultant, Niti Aayog, Government of India. Thank you so much for joining us here today, sir. Sir, so my first question is directed towards you. It is, what are the different initiatives taken by the government for implementing cervical health?
Anviti, please come again. I could not follow the question.
Yeah. So the question is, what are the different initiatives taken by the government for implementing cervical health?
Okay, that's fine, because there was some distraction here. That's why I have to repeat it.
Right.
Sorry.
No problem, sir.
Okay, one thing, if you look at the initiatives which have been started, you have to go way back in 1975 when we started with the cancer program, which focused on strengthening the apex cancer centers. It was only highlighted in strengthening the capacities of the cancer centers for treatment of the cancers. There was no program per se for preventive and promotive aspects of the cancer. Then in 1984, the district cancer event program started, which where the early detection and the screening program saw some light into that. Then in the early 2000s, then the program was further expanded to include more activities, right from screening, right from health education, as well as strengthening of this cancer care in the country. Then recently now it has been added as a part and parcel of the NPCDC program, that is National Prevention of Cancer Control and Non-Communicable Disease. That is a part and parcel of that. Apart from that, nothing much has happened in the detection of the cervical cancer. That in few districts we started with the immunization program in some of the districts way back in the early 2000s. But due to some adverse events, it was stalled. Now again, the vaccination program has started in 2016, where you might see that they are now doing in a guarded and a staggered way, because whenever if any large scale program with some adverse events happens, then we have to be going in a very guarded way. Now we see that how it picks up, how the awareness activities which are already part and parcel of this, they are all picked up. A lot of activities have to be done. The more promising aspect is the upgradation of the sub-health centers, where the population-based screening for this cervical screening and can happen. The upgradation of the sub-health centers into health and wellness centers. We used to have around 170,000 health and sub-health centers, which eventually would be upgraded to health and wellness center with a it's a nurse-driven thing. That means the community health officer is essentially a nurse practitioners, and so that the screening can happen visually as well as the pap smear can also happen. Because cytological screening is very difficult, but the visual screening can now be very much possible at the sub-health center. So these are all the efforts which we have been making, and see that how it moves ahead in the coming days. But it's all still work in progress, and we have to see that how things unfold and how we are able to prevent the second leading cause of the death in the country. Okay.
Definitely, sir. That was quite insightful. My next question towards you is shed some light on cervical health of the general public and the importance of cervical health screening, especially in the rural areas, because we need it more there.
If you look at the rural characteristics, right from the fertility aspect, first we have to understand the determinants for the reproductive health of a rural population. In the rural areas, if you talk about the age at marriage and age at first conception, so still a lot of work is to be done. That means age at marriage, previously the demographer used to say it is 16, 17. And the age of first conception is also similarly the same age. And apart from that, the living condition, the hygienic condition, talk about the reproductive and the genital hygiene. That is also one of the determinant factors. I just highlighting of the factors before talking about what are the challenges are there in the rural sector. So these are the hygienic practices. The effort has been made to reduce the reproductive infections in the population. Right in the urban areas, lot of things are picked up, but still in the rural areas, the taboos and the practices which are there, a lot of work is to be done in the rural areas as well. Second, apart from that, you look at the reproductive infections in the reproductive age group or the 15 to 45 age group, you will find that the strong contrast between the urban and the rural areas. In the urban areas, people are more aware, but if you come to the peri-urban areas and the slum areas, you find the more worse condition than the rural areas. Okay, that means we have to take the peri-urban area, the slum areas, and the rural areas in a different kind of a cluster. So that kind of approach should be there. The problems in the slum areas are different, the urban areas are different, and the rural areas are different. We have to see that how to handle that thing. The other determinants is the number of pregnancies the woman is having. Now the number of children, you can have restriction because of the other services, the medical determination of pregnancy, the contraceptions and other things. But That is also one of the important determinant for the cause of predisposing cause for this cervical cancer. The other factor is the use of the oral contraceptive. That's it. Because that's very easy to take. But the oral contraceptives, they have been supposed to be associated with the rise in the cancer incidence. Apart from that, there are other factors also, but essentially for addressing any of the rural areas, for improving, right from improving the general hygiene to the reproductive health, then addressing the issues of age at marriage, the age at this, these are still challenging. These all are compounded with the fact that the awareness for knowing changes happening at their genital areas, because they are not aware, they think that it's a normal phenomenon. Whatever small change they are happening, if you look at the breast cancer awareness, the woman has to do self-examination. Then only she can know whether some changes are there or not. But for the cervical this, do we have that kind of mechanism? No. Here also awareness as well as at least confiding with the practitioner there at the rural areas. That would be the key. The moment she is having some problem, some abnormal thing, immediately she should be aware enough to go and seek the services. Lot of things are to be done. The ASHA health worker, we are having more than 900,000 ASHA workers across the country. But we have to educate them so that the woman has confidence in sharing their problems with the community health worker. They are the women worker, but still there's a lot of hesitation in coming forward and expressing their problem. That's a major thing. If you are able to make dent on this area, that means people can come forward and seek guidance from at least the community health volunteer and then the community health officers in the reposition the sub health centers as health and wellness centers. Then lot can happen into this area. I think I've been able to express myself about the question.
Definitely, sir. So can you talk a little about cervical screening in the rural areas, the importance?
This is a very important question which you have asked, because if you want to, because pap smear is one of the established thing, because if you talk about cervical cancer, one of the causative factor is the papillomavirus. Though we have a vaccine against that, but due to some other adverse events, the vaccination has not picked up that space which it ought to have. But still, it is not included in the national program. But pilots are going on. Regarding the screening thing, we have to focus on the visual screening, because there are method VIP, VIA, and other methods are there. We have to see that how we focus and popularize the visual screening. At least once a while, when the woman is there with the health volunteers, we have to teach the community health volunteers, the ASHA workers, as well as the community health officers in screening of the women at least do a visual examination. And if something is adversely found in the visual examination, that can be subjected for PAP screening and everything. Going for a PAP screening is whether it is cost effective or not. We should be finding ways of making it more effective. Otherwise, cytological things are very expensive. It's not that it can be easily done. For population-based screening, visual screening can happen provided there is capacities at the rural level, at the worker level, so that they can at least screen and bring that person at some institution like primary health center or community health center, where the pap smear and other facilities can happen. So this is a way. A lot has to be done on this pap screening and the this. Otherwise, unless the cutting edge, which I think that would be, is that creating awareness about knowing about the problem. Then, if the problem is there, we have to create capacities in the health workers as well as in the community health officers, so that this kind of screening happen. Apart from that, population-based screening, you have to organize camps. It has to be done in an organized way because lot of privacy and other issues are there. You have to see that how we organize camps and take the things forward from there. So, the bottom line is that the community-based screening is the key for preventing this preventable cervical cancers.
Thank you so much, sir. Now let's take this session further by inviting two of our other esteemed panelists for today's session. I take immense pleasure in inviting Dr. Priya Ganesh Kumar, Chairperson, Oncology Committee for FOGSI and Medical Director of Sainavas. Welcome, ma'am. And Ms. Geetanjali Roy Chowdhury, Business Head, Women's Health Solutions, GenWorks Health. Thank you so much for joining us today, ma'am.
Thank you.
Thank you.
Now, without any further ado, I will move on to the questions. My first question is directed towards you, Dr. Priya Ganesh. Now, as a chairperson of FOGSI, what are the challenges that you've come across from patients as well as clinicians in adoption of screening for cervical cancer?
So, thank you very much, Anviti, for inviting me in this esteemed panel discussion, which is the need of the hour for today. And thank you, GenWorks, for inviting me. So, as a FOGSI Oncology Committee chairperson, definitely we have run few surveys across the country to understand the actual scenario prevailing in the community, and also we have run through one survey for our doctors, trying to understand the level of understanding regarding the prevention part and the screening part, and how they are adopting it into their day-to-day clinical practice and their role into it. So let me first highlight what we actually found in the public survey. And it was really a eye-opening thing for us, though the fact we know that not much advocacy has been done yet when it comes to put through the message that cervical cancer is the only cancer which is a preventable cancer. So what we came to know, it was around 4,000 ladies across the country from Pan India had taken part in this survey. And also we ran few AV videos in their respective languages and took up the post AV survey as well to know how far has it really improved their taking up of this screening and vaccination. You will be surprised to know that only few, it was around 44% of the ladies knew about vaccination, something like HPV vaccination is existing in the country. And around only 40% had taken up a primary screening. Or might be they would have taken up a screening because they had some problem, but not many people, around only 30% knew that primary screening is done for those ladies who are symptomless. So moving up from here, we really have to play a lot of role in focusing this matter, that it is not only the people who have the disease or symptoms come forward for a screening. That was one part. And then when we played this AV, we have made AV videos, audio video, this communication in 8 different languages, putting up focus on cervical cancer prevention and its treatment, detection with colposcopy, treatment of CINs, and how cervical cancer can be prevented. Many ladies have now enrolled and also have taken part in this program. Coming to healthcare providers. As a survey, what we understood was most of the doctors are aware of the fact that cervical cancer is the only cancer which can be prevented. And also they knew about it. The only thing differences comes is, are you truly adopting it in your day-to-day practice, or are you taking... So the challenge goes is counseling. If a lady comes with no symptoms and she's just accompanying another lady, to counsel this part of the lady to take further enroll for the screening program, now that becomes a little challenge for the doctors because of the hard press of time. And another thing is, yes, we do have to have skill enhancement programs, skill development programs for the doctors so that their confidence really increases. For this, we have come up with Swasthya Sundar Nari Prevent the Preventable program now, which has already covered around 88 societies so far. So FOGSI as such is the largest professional organization for the gynecologists of India, and it comprises of 38,000 strong doctors, all the gynecologists of the country, and it has been playing a major role in skill enhancements and confidence buildings in the in the gynecologist per se. So this SSNPP programs is well taken, and we have almost covered about 16,000 gynecologists so far from when we started in the month of August until date. So this is what we are doing from FOGSI, and FOGSI is also doing all sort of good programs in associations with WHO, with FIGO, to get this on the platform. And yes, FOGSI is playing its major role in it.
Thank you so much, ma'am. Also, can you tell us what made you get into creating the first preventive oncology center across the country?
Yes, this is a very passionate question and a passionate area of interest for me. As a teacher or a course convener for colposcopy and preventive oncology in FOGSI, and we have been doing from Sainivas Healthcare also, we have been doing this fellowship courses since now a decade and a half. And almost 1,500 gynecologists have taken hands-on training program from me. Last year, we started this online courses as well. Also now through as a WHO course convener for the country, one of the course conveners for the country, many doctors have also taken WHO courses. Now, all this said and done, so skill enhancement, training sessions, everything is done so well. But then when I saw that actually when people take trainings and they go back, they are highly empowered, and when they start actually doing it, there are so many questions which then it's like an opening up of a Pandora box, and you do want to have some mentor to fall back on. I mean, whom do you fall back on, and whom will you ask these questions, and how do you establish yourself as a ambassador sort of a thing in your respective area, where people look towards you and people start referring cases to you, because not everyone are doing a colposcopy, or not everyone are adept in doing this what you can call is comprehensive, like even the treatment for CINs. So when I saw that, and so many of the doctors came forward and said, "Madam, we do want a mentoring programs as well, so that we can come in touch with you." And that's how we then started. In the year of 2016, we enrolled in this program, where we had this, because till then we had understood, basically we did understand what are the, we have already gone through that phase of establishing ourselves as an ambassador in this field, or you can say. And we were the first people to start the preventive oncology comprehensive centers in Thane district. So knowing the fact that we have crossed this phase in a long, hard way, we wanted to cut it short for the people who are truly interested in taking up this field, taking up this sector, and especially in the tier 2, tier 3 cities, where there is definitely a need of a well-established established center to, for the betterment of the community and also for the doctors who can refer the cases there. And that's how then our franchisee centers started. Doctors started coming forward. They wanted to get attached with us. And so far, we now have 30 franchise centers pan-India. It is working on the principle of, a standardized program, a standardized reporting system, utilizing all the WHO advanced techniques for screening, say HPV, which is in a validated way, and also then giving the right type of treatment to the patients. And then we also have call recall system, surveillance system, and through this franchise model, which is I probably think is the first of its kind in the country, we have been able to cater to around 1.5 million population and ladies in our country. And that's how we have gone into the depth, the heart of villages and Adivasi villages, and really been able to work for the community. And we have been also screened. So far, we have been able to save, around 4,000 to 4,500 ladies to develop into cervical cancer by treating them at the earliest stage, at the CIN stage itself, in the pre-cancerous stage. And our motto always remains of save uterus, do not do unnecessary hysterectomies. And I have seen over these years, the doctors who have taken our franchise and are now our established colposcopists and preventive oncologists in their respective areas, and they have been also working with the PPP model with the government also. So the government also is now recognizing these centers and are able to refer the cases which government isn't able to do to these centers as well. And even the Navratna companies also are highly interested, and they are also tying up with these centers. And that's how we are being building chains, throughout.
That was quite insightful. My last question towards you is, now we all know WHO's 2030 mission is of eradication of cervical cancer. How are you working towards that mission?
Yeah, so 90. So this has become a very famous mission, and I think it is possible only when we do go into the heart of the community, and we have a three-pronged approach. Now, the three-pronged approach would be first of all is public awareness. That's the public arm. The second arm would be for skill enhancement of the doctors who can take it, and the third arm is a political awakening. So all these three arms put together, we would be in a position to have this goal, at least 75% of the goal can be taken, will be completed successfully by 2030. We do have this fantastic mission of 2030 cervical cancer eradication. So what we thought about it is most of 60% of our doctors are private healthcare providers. And most of them are also practicing to tier 3 cities. If we definitely want cervical cancer eradication in the country by 2030, it's not only the doctors, but also it has to go to masses. Now we have to work towards masses. Now for this, we are coming up, most probably this also would be the first innovations in the healthcare system in preventive oncology, which our Srinivas Healthcare is looking forward. We are working onto it, and most probably by this month end, we would be able to roll it up and also inaugurate this hub spoke model. So hub is Srinivas Healthcare, and the spokes are different areas. So we are looking out for, and this is of course with a technology partner with GenWorks. They are giving the technology to us, and they also have AI augmented screening devices, because we truly believe that it's not healthcare promoting or coaxing the ladies to go into these centers. It has to be the ladies themselves should get initiated. The masses should be able to walk into the centers and get themselves screened. So that's where exactly we are putting our focus into. And these centers would be catering to all the masses, exclusively in the tier 2, tier 3 cities, where you might not find a professional consultant sitting over there. And then if you do not get that professional advice or the consultant, you do not expect this also in a very small town or a small tier 3 city. But then the ladies out there should not be suffering, because of the lack of technology. So we are actually taking the technology along with the GenWorks. We are taking it to the heart of the country, you can say rural villages and rural areas, put up to the masses, opening up centers where there would be fantastic screening coming up. It's a whole gamut, like complete solution for a women's preventive health, depending upon the breast health as well, and also for the cervical health. So we are not putting up as cancers or anything. We are talking about generalized good health or pink health for the women, dealing with breast as well as cervical, because we all know the cervical cancer is the only cancer which can be preventable. And if we are able to successfully launch this program and take it forward, I think that would be the way forward for getting this mission of 2030 of WHO for cervical cancer eradication.
That was truly amazing. Thank you, ma'am. My next question is towards Ms. Geetanjali. What are the limitations for cervical screening that we face today?
Before I get into this, I would really like to thank all our esteemed panelists, Dr. K. Madan Gopal and Dr. Priya Ganesh, for throwing light on how government policies, because we heard Dr. Priya very nicely talking about how she's working and the entire fraternity is working to create awareness, and we heard from Dr. K. Madan Gopal at how government is taking initiative and making policies that will enable screening. Now, when it comes to us as a technology partner at GenWorks, customer needs are integral to us. So whenever we look at a solution or we look at getting products, it is the key thing for us is it has to be integral to what our customers are looking for. Now coming back to that's how we choose products in GenWorks. Now coming up to what are the biggest challenges that we as a technology partner see in terms of screening space is the biggest challenge in cervical assessment is the availability of device that are at point of care and which can deliver high quality diagnostic images. And moreover, it should be and it can be used by any trained paramedics. Now moving to, so what is currently available, what is being used are colposcopy that are huge and bulky, which makes it difficult to be deployed at point of care. And moreover, it needs experts to be there. And we know that experts are not available everywhere. As you move more from the city to a tier 2, tier 3 and beyond, the experts and specialist availability becomes a challenge. So this limits our capability of doing mass screening, early detection, and ensuring that we intervene early to have to ensure we give better lives to our patients. And this what happens as a result is patients come at later stage, advanced stages of cancer. So this is what is our perspective.
That was great. And can you also tell us how GenWorks, along with mobile ODT, is using the EVA device to solve for these limitations, and how is it fitting in perfectly with these?
So EVA is a smart handheld digital colposcope. It can be easily deployed at point of care and can be used by any trained paramedic. And one more thing which is very interesting with EVA is that it is it is powered by AI. It is powered by an hybrid AI, which involves both biopsies and human annotation, which makes it much more accurate. And to top it to it is it's cloud connected, which allows the experts to use the device anywhere from anywhere, access the images on their laptop, on their mobile, and even it offers a teleconsultation platform for the clinicians to connect with an expert or each other and take opinions. What it even delivers, and it is based on a mobile platform, and it is enabled to deliver colposcopy grade imaging. This leads to, and this it helps us to overcome the challenges that we face to do mass screening and early intervention and early detection. This is what EVA has to offer.
Thank you so much, ma'am. Thank you, Dr. Priya Ganesh and Ms. Geetanjali Chowdhury for joining us in today's session. It was a very fruitful session, and I'm sure our viewers are taking away some key points from this. Thank you so much for joining us today.
Thank
you very much, GenWorks, and thank you very much, Anviti.
Thanks.
And thank you very much, Geetanjali. Sure, EVA is the technology in the future and the present. So that's
Thank
going to
you.
create a revolution in preventive oncology. And let's see, 2030 has a great, EVA plays a major role in 2030 mission. Thank you very much.
Yes, ma'am. Together we will.
Sure.